Thank you all for being here this morning. So I come to you today, I was born in the year 1989. I know we don't like to reveal our ages, you can do the math. But I bring that up because 1989 is also the year that the US invaded Panama. It's the year that the Exxon Valdez caused one of the most ecologically damaging oil spills in history. It's the year that thousands of democracy protesters were massacred in Tiananmen Square, and the year that the Berlin Wall fell. It was a chaotic capstone to what many have termed a lost decade, in which soaring inflation rates caused a debt crisis, economic stagnation, and rising inequality. It might sound a little familiar. But in this lost decade, something was found. Because even as ministers of health at that time were grappling with declining aid, with brutal structural adjustment programs, they were making bold plans. Because UNICEF's Jim Grant, during that period, had been rallying researchers and ministers of health and frontline health workers around a single, profound, and important goal: save the lives of children. And that's what they did. Ceasefires were declared. Health programs were introduced. And by the end of the decade, the vaccination rate for children had climbed from 20 to 80%. In the year 1990, at the end of the lost decade, more than 25 million children who otherwise would have died were alive. Today, the ground shakes again. We have a climate that is spiraling out of control. We have more conflict at this moment in history than at any time since the end of World War II. And of course, we have cratering trust in our shared institutions. And once again, we are told that there is no money. And yet history has already told us that progress is not just a question of fortune, but of focus. The animating question behind the child survival revolution in the 1980s wasn't just, what can we afford? It was, what can we not afford to defer, even in moments of calamity and scarcity? And it's animated by those questions that more than 30 community health workers and researchers from more than 5 different continents across Community Health Impact Coalition came together over the last 2 years. What did we do? We systematically identified and analyzed every single study, piece of economic evidence published over the last decade on community health workers. That's 255 studies describing more than 380 community health program scenarios. The results of that work are unambiguous, and I'm going to take you through them now. If you want to save children, and you want to do them in a cost-effective way, and in a way that absolutely cannot be deferred despite the challenges that we now face, community health workers are the answer. They were found to be effective in more than 80% of cases when treating mental health, non-communicable diseases, and more than 90% of cases when treating mothers, children, HIV, TB, malaria, the list goes on. In fact, there's so many things that they do, we needed to publish it in 5 separate papers. And they're linked on your QR code. You can access those as they're currently coming out in the academic literature. And I think it's important to note the price point of all this, right? This is just $10 per patient per year. Or, put another way, $6 per person per year for a comprehensive package of primary health care, everything from vitamin A supplementation to treating malaria cases. That is a rounding error for most high-income health systems, and it's about 5% of what most low-income countries spend per capita on health every single year. The bang for the buck is there. Because when we invest in community health workers properly, supporting them, they stretch dollars, they reach more people, and they do so with better value for money. Community health workers, it's important to note, don't just match facility-based or other types of models. They consistently exceed those targets. They consistently exceed those outcomes. And it's worth noting that they're not just doing this in ideal conditions, right? Community health workers are reaching the people that other parts of the health system or other models are not reaching. In one of the studies we found from Tanzania and Kenya, community health workers were actually able to reach mothers and children in some of the most remote areas of both of those countries. And yet if you looked at the health outcomes of those mothers and children, they were better than the health outcomes of those mothers and children being treated at the nearest facility. And of course it was done for less money. And why is that? That's because community health workers don't just deliver care. They deliver proximity. They deliver cultural fluency. They deliver staying power, something an algorithm might find difficult to replicate. And I think another really important finding of this giant, most comprehensive cost-effectiveness analysis of community health workers to date is that the economic evidence reconfirms what the impact evidence has long told us and what Community Health Impact Coalition has long advocated. And that is that not all community health programs are created equal. One of the key findings was that integration is a value multiplier. What does that mean? That means if a community health worker is connected to a nearby health facility, they are digitally enabled, they have salaries, they are accredited, and they are providing care for multiple types of ailments at once. So again, everything from vitamin A, HIV, malaria, they are far more likely, that program is far more likely to be cost effective than a single disease vertical program. Effective altruists, take notes. We want to follow the evidence here, right? And I think it's important to note that when we're investing in community health workers professionally, as professionals, we're not just saving money, right? We're saving lives, we're stretching resources, and we're preparing systems such that they don't crumble in the face of the next crisis, as Margaret shared. In 1989, a unified coalition of actors proved that even a small band of folks who are committed to an idea can bend the arc of history. It's because leaders in the 1980s invested with clarity, with confidence in health, that 25 million people, my exact age, are alive today. Our crises demand that same clarity, that same long effort in a single direction. Because ultimately, history is not written by people who simply capitulate to the conditions of their age. It is written by the people who find a way.